I want to talk about Asian rhinoplasty. I performed quite a few Asian rhinoplasties or Asian nose jobs. The term Asian is also very confusing because is it Indian? Sort of. Usually it's not, because Indian is more for me just a general category of ethnicity that is more a combination of some white portions. There are some portions of African, potentially some portions of Asian. It's very confusing. I'm talking, when I talk about Asian, Southeast Asian, or East Asian. So we're talking about China, Korea, Japanese, and some Polynesian noses as well that have some Hispanic qualities because of the fact that that's another video about Hispanic rhinoplasty, but the fact that there's this continuity potentially across the Bering Strait of the Hispanic nose and the Asian nose. But I'm basically talking about Southeast Asian, Polynesian, and Eastern Asian noses. So what are the characteristics of these noses? Typically a flatter bridge, typically a broader tip, typically a broader base here, thicker skin, under projected nose. In other words, it's not sticking out far enough. The biggest thing to understand with this is that I've seen with Asian noses is the bridge is too high. That's the #1 telltale sign to me that it looks fake. How do I know a bridge is too high? Well, first of all, it's a gestalt of looking at a face and making sure that it fits your face. But the other component is that if you look at a side view, the middle portion of the eye, the pupil on the side view, that's about the height of an ideal Asian nose. And low Asian nose typically starts at the bottom of the eye or below it. And a white nose starts at above the crease of the eyelid. That's way too high, and that's oftentimes what is a telltale sign that the nose is fake. The other telltale sign is the nose is too pointy. What usually causes a bridge to be too high and the tip to be too pointy is a silicone implant. So I don't use silicone implants. Unfortunately, for my first 2 years in practice, I've been in practice 20 years now, I use silicone implants. Silicone implants are terrible. The problem with them is that they over collapse the nose inwards. You can see the element of the sides of the bridge. You can see that the tip looks too pointy and it becomes more and more problem. They get infected. They start to push down into the nose. They create tip problems, infection, displacement. I can go on and on. If you're thinking about a rhinoplasty and thinking about a silicone implant of any kind, don't do it. Now, you say, Dr. Lamb, do you do silicone implants? Yeah, the chin actually is an incredible location for silicone. It's so stable, but in the nose, it's a real problem. So do not use silicone implants of any kind. The old days when I used what's called single piece augmentation, which meant I used a single silicone implant, that's when I saw the problems, when there's alloplast or artificial material on the tip of the nose. So I moved over to which are called two-piece augmentation, where I used a silicone implant on the bridge and a cartilage graft at the tip. That also doesn't work. So silicone implant in general causes a lot of displacement, shifting. I don't use it. For about 10 years, I moved over to Gore-Tex, or the formal name is EPTFE, or expanded polytetrafluoroethylene. That's a mouthful. EPTFE or Gore-Tex is an implant that I actually had very few complications with. I loved using it. I don't remember seeing an infection in my hands. It looked good, but I stopped using it for a few reasons. I really wanted to get rid of the alloplast or anything artificial in the nose. I think there's always a problem in the future when I do that. The other problem is sometimes I saw displacement of the implant. It looked a little bit too strong, even though it was so much softer than the silicone. They're very hard to remove, there's a problem, and they also compress, so they lose about 1 to 2 millimeters over 3 to 5 years. So these are the reasons I've migrated away from silicone. Now Gore-Tex. MedPore is terrible, you can't remove it. Don't use other alloplasts or artificial materials if possible. What I do now is diced rib graft. I use a cadaveric rib. There's been a study recently looking at autologous versus homologous, fancy words to describe your own rib versus a rib from elsewhere. The benefit of doing homologous is there's no incision or scar, but the diced rib graft, which I go into much more detail in my ethnic rhinoplasty video, I'm not going to go through it here, has allowed a much softer look, a much less chance of warping or distortion over the long end, less chance of resorption, much more natural. And the tip, I use what's called an extended caudal septal extension graft, which again I go through much more detail through the rest of the website, and also through more details in the section on ethnic rhinoplasty, so I won't talk about it, but it allows me so many maneuvers toward getting a structurally strong tip that's preserved over time that looks so natural in nature. So this is just a tip of the iceberg video introducing you to the concepts, the evolution of me as a surgeon, specifically for Asian rhinoplasty. please watch the rhinoplasty video, the ethnic rhinoplasty video virtual consultation, and any other things that may be applicable for you.